My name is Josephine Renton, and I live in the town of Broadstairs on the coast, which is an hour and a half drive from the hospital, but it's a beautiful drive through the forest and the woods and the scenery, and I really loved it. I had an awful pain in my thigh. I couldn't sort of stretch that leg back, and so I went to the doctor, and he said, "That's your hip, it's not your thigh." He said, "Do you feel it?" He said, "Your hip." You know, I said, "No, I don't think it hurts." But it wasn't too bad for at least 6 months. I could still walk. It was about a year later, I went to the doctor again, and I said, "Look, it's got worse." And this time he sent me to a specialist where I had an X-ray. When I went to Benidorm, I had an appointment to see Mr. Matthew Oliver. We had a very productive initial consultation. My X-rays had been forwarded to him, and he explained them to me. And he said, "Yes, so, you know, look at this, and you can see how bad it is." I was very impressed that he explained the X-ray to me, because to the layman you really can't tell why things are bad and it needs repairing. And he told me exactly what he was going to do. And it sounded a bit, but I thought, well, hundreds of thousands of people have this operation, and they're all right afterwards. So, so I didn't, although it sounded drastic, I wasn't really worried. In fact, I wasn't worried about the operation. Matthew Oliver had talked me through it, and I'd talked to various friends who'd had the operation, and I came to the conclusion there was very little to worry about. You know, the main thing I was worried about was the aftermath, how helpless I'd be. I mean, I'm a very independent person, and I hate being helpless in any shape or form. But as a matter of fact, I really wasn't. That was cut to the minimum. And by the time I got home, I was already independent in the essential things in life. I was quite ambitious regarding the speed of my recovery. After 2 days, my crutches were collecting dust in the corner, and I graduated to a walking stick. And after another few days, no, I would say a week, when I was using the walking stick indoors and outdoors, I didn't use the walking stick indoors anymore, and I just used it outdoors. And I remember 2 weeks after my operation, I'm a churchgoer, and I'm in the choir. And I remember 2 weeks afterwards, I walked down the aisle in the church without a walking stick or without anything. It's an absolutely lovely hospital. You really have the feeling, yes, I am a private patient. This is a private hospital. I found everybody very helpful, and the general ambience very pleasant. I really did.